Hello all, myself Dr. Abhilasha. Once again we'll see one patient's journey with Banker's Vascular Center. We are having Mr. Raghav with us from Chennai, and he was having vascular malformations in his left hand. Basically, Mr. Raghav is working as an IT professional in well-reputed company, but he was facing too many difficulties with his hand to work on a professional basis also, in daily activities also. So we will see the journey of Mr. Raghav before he selected the Banker's Vascular Center and after with Banker's Vascular Center. Hello Raghav,
Hi.
how are you?
Excellent.
You are having vascular malformations, right?
Yes.
So how you came to know that you were having vascular malformation?
So
The condition about actually.
yeah, so I've had this for a few years, and I didn't know the name of the condition first of all. So when I went to regular clinics or regular general doctors, they just to be honest, the first time I went to the doctor, they gave me an ointment which had nothing to do with anything. But that's the level of awareness about this illness that people have, even in the medical industry, because it's a rare condition, so people generally don't know about it. But I eventually I looked up what is what is this, and I was able to understand that this is because of like something with the veins. So I went to some vein specialists, couple of really top level vein specialists in Chennai, and they explained that they gave me the name. The first time I knew that there was a name for this condition, because I had no idea, like there was no information about this. So they diagnosed it as a slow flow venous malformation, and it's not as risky as some other kind of venous malformations, but it's still an inconvenience to me. So was not able to lift weights. If I ever go to like the gym or something, then my hand swells up. I won't be able to do anything for the next few days or something. And I've always wanted to be more muscular, be lift weights. And I know a lot of other people who have this condition, which are much more severe. Like sometimes they have it on their legs, which they can't even walk after. Sometimes for me, it was relatively minor, but still it's an inconvenience. When you're going through this in your own life, you can understand it's very inconvenient, and it kind of limits you, right? So I had diagnosed. I got diagnosed some time ago, but unfortunately, the thing is that the doctor who diagnosed me told me that there is no treatment for this, because all the treatments are risky, because the veins are all infused in the bones.
Yes.
The veins are all infused in the nerves. So any kind of surgery attempt that you do to remove that malformation will affect the nerves and the bones and everything. And also there is a risk that this can go, it can render your arm completely useless if it is done wrong. So the doctor said that you just have to wear a compression garment. So my venous malformation is from here until on the tips of my finger. So they recommended that you just wear a compression garment for your entire forearm, and that will limit the blood flow, and that will prevent the malformation from going further. And to me, that is not a great solution, because I already have a lot of malformation. I don't want a thing that just prevents it from further growth, but I want something that actually treats it. So I struggled a lot to find the right doctor, and actually only like a year and a half ago is when I went to YouTube and I randomly found Dr. Mohal Banker's YouTube video, and I immediately called them up and set up an appointment, and there was an online kind of like a appointment, because I was in Chennai, and the doctors, he actually one thing I have to mention is that there is a huge thing in the medical industry where people don't answer your questions.
Yes.
If you go to a doctor,
Exactly.
They will get extremely annoyed if you ask questions, and they charge you more actually if you ask questions. And for the first time when I had interaction with Dr. Mohal Banker, he answered everything. He's very patient. He's a really busy guy with so many patients, and he answered all my questions. And I felt really comfortable after that session, and I looked up what is something that we can do to take it further. And I got an appointment, and that's how the first interaction happened.
Okay, and how difficulties are getting off? Like you are having recovery. You have almost Mr. Raghav has almost gone through 7 sessions for vascular malformation treatment. So let me know something about your experience during the treatment and after the treatment, the relieving factors, which all difficulty you got rid of. Some words on that.
Yeah, so the first session that I had, actually I maintain a blog on this that I can probably link in the description of the video where
Sure,
I can read about this. The first session that I had was sometime like I think a year and a half ago. And what happened was that the first time it happened, it was there was a little bit of swelling. I was actually very scared because the first time, because they inject the anesthesia, and I was really scared because like what if the anesthesia is permanent? Like what if I'm not able to use this hand? Or, like, that was a fear. But the doctor informed me that it won't. It's only temporary. Like after 12 hours, will be recovered. And I think everybody, the doctors, the anesthesiologists, everybody has been very, very helpful. They've explained things, everything perfectly, and they're very patient with you, and they inform you beforehand as to what's going to happen. So I've been having a wonderful time, and I've been recommending to other people also who are going through this. So this happened, like the first session happened a year and a half ago, something, and since then I've had like 7 to 8 sessions so far, and every time I've had a really smooth process. And actually today also, this morning I had an interaction with Dr. Mohal Banker, where he explained his strategy basically. Every time he does this, what have you done so far? Exactly where have you injected this? It's really important for patients to be informed about what is happening to their body. Because maybe not everybody is as informed. Because I have some training in medical science as well, so I understand these things. But even if you're not informed, somebody from the patient or the guardian or somebody should know as to what was done. And Dr. Mohal Banker is extremely patient. He explained everything to me. And even the points where we injected, how much ml was injected,
yes,
and what are the potential risks? For example, there is a possibility that there is a temporary loss of sensation in your arm, because the swelling of the veins can compress your nerves, and it can result in a loss of sensation. These things he explains mechanistically, the mechanism of how these things happen, and also his thought process about which area to target and how much to inject. And all these things he explains, explains
very
that,
precisely.
Yeah, because it depends on your body weight. Because you have to also be part of the decision making process, because the doctor cannot decide for you all the time. Because some of the risks you have to involve yourself as a patient.
To face also.
So he does that. He's perfect. I feel like I always tell everybody that I found a perfect doctor, because I've had a long time struggling to find the right doctor.
And symptoms recovery. Will you tell something about symptoms recovery?
So I think when the doctor explained things, he said minimum 2 weeks. It takes few weeks for it to fully recover from it. For me, thankfully, every time that I go through this session, there is maybe for the first 5 days there is some swelling, and after that it's pretty smooth. There is maybe discoloration in the area of injection for some time, but it's been it recovers much faster.
Difficulties are lesser than before.
Okay, there was one session actually. So far in this 8 sessions that I've had so far, there was only one session where I had some issues with sensation. I had a loss of sensation.
Symptoms about you were having the symptoms of.
Oh, you mean improvements?
Improvements, yes.
Okay. So since the beginning, I've had massive amounts of improvements. In terms of how much I can lift. I can lift a lot of weights now. I can start doing push-ups. I was not able to do push-ups for a long time, because every time I do it, there'll be some issue in the wrist or something like that. But there's been tremendous amount of improvement. But I think there's maybe a couple of more sessions that I still have to do. I don't know exactly how many more sessions they needed, but I've definitely seen improvements.
Okay, great. So Banker's Vascular Center is the best choice for vascular malformation, in your words?
I think in India for sure, yeah. I don't know about everywhere else, but I mean that's the reason why I come from Chennai, because every time I come here it costs me 10,000 rupees just for the travel. And I come here precisely because 2 reasons. One is this is a risky procedure that you can't do everywhere, because I know that there are other places where you can do this in India, but I come here for the safety aspect, also because I have a really good relationship with the doctor, which is really important. So, and then also I've seen tangible improvements, and I actually recommend to other patients as well.
Thank you so much, Mr. Raghav. So, absolute ethanol injection is the best treatment, non-operative, without any cut and suture, and very safe. Dr. Mohal Banker is excellent doctor in vascular malformation treatment. So, do contact Banker's Vascular Center for your vascular malformations problems. Thank you.